Hey guys, in this video I'll be talking about the supports of uterus. So uterus is maintained in its position by various number of factors. Now in this video let us talk about all the factors in detail. Okay. Now coming to the supports of the uterus, we will classify them under the primary support and the secondary support. The primary support include the muscular support, fibromuscular ligament and the visceral support of the uterus, and the secondary support include broad ligament of the uterus, uterovesical fold, rectovaginal fold. Okay, now let us talk about this primary support in detail. Now the first one is a muscular support which includes the pelvic diaphragm. This pelvic diaphragm is formed by the levator ani and coccygeus muscle. This pelvic diaphragm is a structure that will be providing support for the pelvic viscera and will prevent the rise in the intra-abdominal pressure. Now coming to the perineal body. What is a perineal body? It's a fibromuscular node. It's a fibromuscular node to which 10 muscles have been attached. What are those 10 muscles? Bulbospongiosus, which are 2 in number, superficial transversus perini, deep transversus perini, levator ani, the pubococcygeus part, the sphincter ani externus, and longitudinal muscle coat of the anal canal. This will be only single number. Remaining every muscle you find them in pairs. So all these muscles get attached to this fibromuscular node that is called the perineal body. Now what for this perineal body is present? This will be anchoring this pelvic diaphragm. And next the urogenital diaphragm. So these three are the muscular support of the uterus. Now coming to the second one is a fibromuscular ligament. It's a fibromuscular ligaments. These fibromuscular ligaments include round ligament of the uterus, transverse cervical ligament, pubocervical ligament, and uterosacral ligament. So let us describe this each of these ligament in detail. The first one becomes the round ligament of the uterus. So first look into this theory and later I'll try to explain every point through the diaphragm. So it's a fibromuscular band of 10 to 12 centimeters long and is present between two layers of broad ligament of the uterus. So what is broad ligament of the uterus? So the broad double fold of peritoneum that is extended from the lateral border of the uterus to the lateral pelvic wall is called the broad ligament. So this broad ligament now will be having two layers. So between these two layers, this round ligament of uterus is found. So you can't see this round ligament either from anterior view or from the posterior view. Hope you can see this from the top view, and is present antero-inferior to the uterine tube. And now let us see the course of this round ligament. See how it is passing. Now it actually begins at the lateral angle called the cornua. The supralateral angles of the uterus is called the cornua or simply called the lateral angle. So it begins at the lateral angle, crosses all the structures in the lateral pelvic wall and will bind around the inferior epigastric artery and via the deep inguinal ring enters the inguinal canal, and finally via the superficial inguinal ring it splits, it moves out and later splits into various fibrous threads, and these fibrous threads get attached to the subcutaneous tissue of the labium majus. Now try to understand this diagram. So this diagram is drawn by looking from the top position. So when you look from the upside, so the diagram is like this. So these are the supralateral angles of the uterus called the cornua. So it begin at the lateral angle of the uterus and it travels, it crosses all the structures present in the lateral pelvic wall and winds around. See, this is the inferior epigastric artery. It winds around the inferior epigastric artery via the deep inguinal ring, enters the inguinal canal, and via the superficial inguinal ring comes out and finally divides into many fibrous threads, and these threads will be attached to the subcutaneous tissue of the labium majus. Okay, this is about the round ligament of the uterus. Now, what is a function? Function of this round ligament is it pulls the uterus forward, again is the backward pull by the uterosacral ligament. See, if you see this diagram, see, this is the round ligament of the uterus. If you see this, so it will be pulling it forward to maintain the anti-flexion and anti-version of this uterus against the backward pull by the uterosacral ligament. This uterosacral ligament, now it will try to pull it backward. So anti to this, it is against to this process, it is trying to pull this uterus forward in order to maintain anti-flexion, anti-version of this uterus. Okay, this is about the round ligament. Now, while describing about this, so an embryological aspect also has to be described. A small invagination of the parietal peritoneum get attached to the uterus by the round ligament through the deep inguinal ring in the inguinal canal. See, when the round ligament is passing through the deep inguinal ring and the inguinal canal, a small invagination of the parietal peritoneum. So, at that part, when the round ligament is traveling in this inguinal canal, so when it is in this position, this invagination is attached to the uterus. So simply to tell, a peritoneal recess that accompany the round ligament in the inguinal canal in the fetal life. Okay, so this is happening in the fetal life. When this will or persist even in the latter life in the female, that we call it as a canal of Nuck. Okay, that we call as a canal of Nuck. So this is homologous to the processus vaginalis of the male anatomy. Okay, this completes about the discussion on the round ligament of the uterus. Now, the other fibromuscular ligaments are the pubocervical, transverse cervical. This transverse cervical are given many other names, namely McEnroth's ligament, cardinal ligament, and the finally the uterosacral ligament. Now let us learn about this only just via diagram, so that becomes easy. Now, the pubocervical ligament, this is a pubic symphysis. This is formed by the condensation of the endopelvic fascia, and is extending between the posterior aspect of the pubic symphysis to the cervix. Okay, this is formed by the condensation of the endopelvic fascia. Now coming to the uterosacral ligament. Uterosacral ligament is extending from the cervix to the S2 vertebra. So this uterosacral ligament function is it pulls the cervix backward and try to maintain the anti-version. Again, as this pull, this round ligament is acting and pulls the cervix or this uterus forward. Okay, now let us talk about this transverse cervical ligament by looking into this diagram. See, this is a broad fan-shaped ligament that extends from the cervix to the fascia covering the levator ani muscle. The fascia covering the levator ani muscle. This transverse cervical ligament is also called McEnroth's ligament or the cardinal ligament, or the lateral cervical ligament. It's also called the lateral cervical ligament. Okay, so there is a clinical importance for this transverse cervical ligament, that is it keeps the cervix in position. So the surgical tightening of this ligament is done in the prolapse of the uterus. So when the uterus becomes prolapsed or it misses its position, tightening of this ligament, it brings back this uterus into its position, because it is a main ligament that keeps the cervix in position. So surgical tightening of this ligament, it will be done in the prolapse of the uterus. Okay, now what is a visceral support? So urinary bladder, vagina, and the uterine axis. So this completes our discussion about the primary support of the uterus, namely the muscular, fibromuscular ligaments, and the visceral support. So these three comes under the primary support. Now let us go to the secondary support. The secondary support include the broad ligament. So the broad ligament is a broad fold of peritoneum that extend between the lateral border of the uterus to the lateral pelvic wall, it will be having two layers, anterior and the posterior. So when the urinary bladder is full, it will be showing two surfaces, the anterior surface and the posterior surface. The anterior surface is related to the upper surface of the urinary bladder and the paravesical fossa, and whereas the posterior surface is related to the mesovarium, which is the posterior extension of the broad ligament to by which it is attached to the ovary, and it will be having four borders. The upper border is a free one, where the anterior and posterior layer are continuous, and lower lateral borders they get attached to the lateral pelvic wall, and the medial border is attached to the lateral margin of the uterus. So this is all about the broad ligament. Now let us see all of them via the diagram. So this what blue thing I have marked here is, this is entire the broad ligament extended from the lateral, see, the lateral margin of the uterus to the lateral pelvic wall, to the lateral pelvic wall it is, and that is the reason why we couldn't see the ovary from the anterior position. So if you want to see ovary, you should see this from the posterior aspect, because anteriorly you will be having broad ligament. Now this ovary, I told you it will be having an anterior layer and a posterior layer. The posterior layer is attached to the ovary by means of the mesovarium. So mesovarium, it actually forms a hilum in the ovary, via which the structures like blood vessels enter and leave. Okay, so this is about the its relation with the ovary. Now coming to the contents of the broad ligament of the uterus. So if you see here, this is the uterine artery, this is the ovarian artery, and this is a eupophoron, and this is a paraphon, and paraphoron, I'm sorry, it's a paraphoron, and this is the ureter, Gartner's duct. And so in the sagittal section you'll be seeing it like this, the round ligament and the ligament of ovary, and there's a uterine artery, fallopian tube, ureter. See, ureter and uterine artery, there is a special relation and a surgical importance also. The uterine artery travels anterior to the ureter. So when you look at suddenly, you feel like both of them like looking like same, but you have to understand this ureter by looking at its what do you see, the contractions. So it will be continuously making some sort of contraction. So this is the only way how you can differentiate in this region between the uterine artery and the ureter. So this is always a surgical importance key. This uterine artery will be passing anterior to the ureter. Okay, now contents of the broad ligament: round ligament of the uterus, uterine tube, ligament of ovary, uterine artery, ovarian artery, eupophoron, paraphoron, and some of the nerve plexus like ovarian, vaginal nerve plexus also can be seen. And the second one is uterovesical pouch. So um, when you consider this as a urinary bladder, and just for consider, so peritoneum will be covering this base of the urinary bladder and up to the isthmus, and later it goes, see, this is the anterior surface of the uterus, and this is the posterior surface. So this anterior surface is flat, and here the peritoneum is covered only up to the isthmus part, from where it is reflected to the base of the urinary bladder as the uterovesical pouch. This is the uterovesical pouch. And this peritoneum, same on the posterior aspect of the body of the uterus, it will be covering up to the posterior fornix of the vagina. This is the posterior fornix of the vagina. Till here it will be covering, and let it get reflected upon this rectus as a recto uterine pouch of Douglas. Okay, this completes the discussion about the secondary support of the uterus also. So now let us go back again. Yeah, finally we have come again to the first area, the primary, secondary. We have discussed everything. Muscular, fibromuscular ligaments, visceral, broad ligament, uterovesical fold, and rectovaginal fold, or something called recto-uterine, rectovaginal. Everything is same. Okay, guys. Now thank you for watching my video. If you do like, if you found it useful, share it with all your friends, and do not forget to subscribe.